So obviously as a result of the coronavirus bill, the local authorities' obligations under some areas of the Care Act have been relaxed. They're calling this the Care Act easements. What particularly that means is that for people who are due an assessment or a review of their support package, that's going to now be prioritised according to risk to those individuals. So provided people are happy and safe, they will obviously fall into a kind of low risk category, and it'd be fairly unlikely that the local authority will prioritise assessments or reviews for those individuals, or it might be that they make slight adaptations to how they do the review process, possibly doing it over the telephone or video call, for example. Some local authorities have created what we're calling a sort of triage system to assess what the level of urgency is for that process to happen, particularly around changes in support need. So I know that some areas are using the Care Act, effectively the eligibility criteria, and they've kind of narrowed down the core criteria in terms of life support for people to basically give their social workers guidance on who to prioritise through this crisis. So in particular, anybody who is unable to achieve without assistance some of these tasks, I'm going to read them out now, would be considered high priority, either unable to achieve on their own, and it would have a significant impact on their well-being, or able to achieve partly some of these activities, but again, without support would have a significant impact on their well-being. So the impact on well-being is really the critical kind of area in this discussion, really. If somebody, by not having something happen, is going to have a significant physical or mental or emotional impact on their well-being, it's pretty likely that would be considered a high priority. So, but the core areas that most authorities are focusing on are around people's maintaining nutrition and hydration, obviously critical. People having support with the medication and any interventions around medication. People that need help with personal hygiene, managing their skin integrity, toilet needs, personal care. People who have behaviours that challenge services that need constant kind of support. People that are unable to make use of their home safely without support. And for family carers, there's around people who are unable to take responsibility for childcare arrangements without support. So those areas are effectively being considered priority one, and that will be for people who can't achieve them on their own or even with support still may struggle. So anybody who kind of fits into those domains, I would expect to see if there was an urgent need for a review or there's a reassessment that was due that's kind of relative to some of those areas, I would expect the local authority to still continue with those reviews in some format, because they effectively are risk areas that would have a high impact on that individual's well-being